Hello, thank you for joining us for another episode of the Dr. Mike and Shannon Show. I'm Shannon Fanenstein, medical technology specialist with UROVAL BRS, Mazan Medical, and we're joined by Chief Medical Officer, Dr. Mike Bradley. Dr. Mike Bradley, can you please introduce yourself for those of us new to joining the show?
So I'm Dr. Mike Bradley. I'm the Chief Medical Officer of Mazan Medical. I'm very happy to be talking to you today about the Bulbocavernosus Reflex System called the UROVAL.
Thank you very much. And for those of you joining us, I do want to apologize. I do sound a little raspy today. I had the pleasure of enjoying Fall Out Boy last night. So between that, singing my heart out, the wonderful fires and the smoke coming down from Canada, because I'm in Northern Virginia, and then also heat, humidity, and allergies. I sound a little raspy, but also we wanted to get this video in because Dr. Mike has a birthday coming up.
Yeah.
And happy birthday, Dr. Mike.
Thank you.
It's going to
Thank you.
be a guys' weekend. And I have a feeling the guys' weekend is going to be a lot like the hangover.
Oh, I hope not. Oh,
So he
no.
might not be functioning this weekend. And quick question for you. Which character from the hangover do you think you would be? I know who I would be. I would love to hear after the end of the weekend who was which character. We all know in our little posse or tribe, we all have friends that are one of each of the characters. So who would yours be?
I worry I'd be the dentist. I'm worried that would be who I would end up being. Is I would lose a tooth that I pulled out myself because somebody dared me to. And I for some reason I'd love to be, the good-looking guy or the guy that gets kidnapped. Maybe I'd be the kidnapped guy. But no, I'd most likely be the guy that pulls his own tooth out and doesn't remember anything and gets into all kinds of trouble. That feels like that would be me out of that deal.
Oh, that's hilarious. Yeah, I would totally be Bradley Cooper.
Bradley Cooper. Okay. Yeah.
I would be the instigator. So,
The
all
instigator.
seriousness, we want to talk about, we've had a lot of people, ask the questions. I know I have from friends and family, that they've gone to the doctor, they've asked their questions to their either primary specialist, OBGYN, their urologist, their internal medicine doctor. A lot of people see those as well. So they've asked their 5 questions. So go through the process. What will the next steps be for the UROVAL BRS screening?
So yeah, if your doctor owns a UROVAL, to be able to check your sacral nerve, because it's really the only way to be able to truly get that latency time. What's going to happen is they're going to have you in a room. You're going to dress from the waist down, pants and underwear, right? We're checking the urinary system. We have to get undressed for that. Then they're going to put these 2 sticky EMGs around your butt, around your bum, right around the anal sphincter. Because what they're looking for is that anal wink, which is really funny that we all have. We all know about our wink, but we actually have a wink down there called our anal wink.
Which I never would have thought of, and nobody's ever told me I've winked at them.
Yes,
unfortunately.
and what's crazy is when I teach people pelvic floor rehab, I tell them wink your eye and then wink your hole. Wink your eye and then wink your hole. And what's interesting in our bodies, there's really only 3 spots in our body that create that same motion as a wink. It's here.
Now, how many of you are doing that now?
Right.
How many of you are watching this? Winking your
they're winking and they're winking.
Hopefully you're not sitting in front of other people and they're looking at you funny.
It's a great way to be able to teach what I teach in pelvic floor, which I don't teach Kegels. I don't believe in them. I actually teach a different type of exercise. And that wink, or the ability for the body to wink, is a muscle we can control, and it's a muscle very similar to our eye. Now imagine if you had like a piece of dirt in your eye, and you know how you wink uncontrollably, right? Well, that's a mechanical stimulation, right? A touch that causes your eye to automatically wink. Well, your hole does exactly the same thing. So we put these 2 little EMGs around the hole, and then
Which EMGs, by the way, for those of us who've had waxing, They are not like waxing. They
Not
are
like
not
waxing.
painful to remove. Go right ahead. Sorry.
Yes. So, it allows for us to be able to, those allow us to be able to measure the movement of the muscle, right? So from the time that I stimulate the clitoris or the vagina or the penis to the time that my reaction occurs, that is that latency time. So we put the two little stickies around the anal sphincter. We'll put one little sticky at the bony part of your body. That's to ground out the signal, right? So that we're really just getting those specific muscles that we're looking to measure the time or the reaction time on. Then what they do is they take a very simple probe, which I actually have one right here. And I don't know if you guys can see
Yep.
this or
We
not.
call it the magic wand.
Magic wand, and they have a little disposable tip because we don't share tips with people. We want to make sure that it's, as clean and sanitary as possible. And all they're
And
going
the
to
nice
do,
thing with that tip is it only has a 15-minute limit on it. So nobody can
yep,
use it again. It's
yeah,
not able to be reused.
we do that on purpose to make sure that people aren't accidentally, even, I don't accuse anyone of anything, but accidentally, using the same tip twice. So when they actually put it in, if it's expired, the computer will tell them that it's an expired tip, so they don't accidentally use the same tip twice for two different people, because we're touching a very sensitive part of the body, right? So we don't want cross contamination. So what they'll do at that point is it'll be a simple touch, touch, touch. And what we're looking for is that EMG response on the screen. Once we see the response, the wink, that's when we as physicians can actually click on that link or that movement, right? That wink. And then when we click on it, from the time we've started the test to the time that we've got that actual reaction is our latency time. Latency time being just how long does it take between a mechanical stimulation and the wink. And that's what it does. That information gives us a lot of detail about direction we can go to be able to treat. It allows us to know if we're dealing with a neurological issue or if we're actually dealing with a more of a, like a muscle-based issue or something else. It shows us if there's spasm. We can tell if possibly there's budding MS going on or ALS. There's some very interesting things that we can find from doing one of these kind of tests. And so that's essentially what it is. It's painless, it's fast, and it gives us really good information. Non-invasive, I'm not sticking that giant probe in anything, special. I'm doing it on
Wand, magic wand.
magic wand. Yeah, we're no probing.
No probing.
Nothing's going into weird spots. But no, it does tell us some very, very good information and gives us direction based on that information on way we can treat patients more effectively and give them a better chance of not wasting their time on treatments that probably wouldn't do any good. And I
And
think
what's
that's
very important is for you as the patient and for you as the provider, this data is instantaneous. So your patient, one, does not have to wait and sit there and sweat for 2 or 3 days waiting for test results. They're able to go home that day with a plan. So you and your patient are able to look at that data, look at that latency time, and now you're able to send them home with, okay, here's our next step, instead of waiting, calling them, trying to get them back onto the calendar, trying to coordinate with their schedule. Now you and both are able to walk out of that appointment with peace of mind that you know what you're going to be doing moving forward. And I think, for me as a patient, I find that very, very valuable.
It's just fast. It's fast, painless, and non-invasive. I mean, those are three things that every patient wants to hear, especially if they're going to a urologist. Because generally the procedures that we do, the tests that we do in urology is not painless. It's not non-invasive, and it's not fast, to your point. When we send off a culture to the lab, sometimes it takes 2 or 3 days to get that result back. And in that entire time, patients know they're suffering a little bit during that time. And it's really unfortunate.
And not only that, we've all been there, especially after COVID, and we know now how long it takes to get into a specialist appointment. So a lot of times patients are waiting 2 to 3 months just to get into that appointment. So now, if you were having to go in and do some kind of procedure that you had to come back for, let's say like a urodynamics or something else, this is a great way to be able to have that first step and to be able to rule out some different, as we discussed in past episodes, some different treatment plans and be able to start with, or at least have a pathway to what's going on next because of the time it takes to get back in. And not only is this procedure able to be done by a specialist, but we can also do this with an internal medicine doctor can do it. We have OBGYNs, which are a little bit easier to get in, a little bit faster, not always. I know mine still is very booked up. Internal medicine physicians, so we do have different avenues of practitioners who can bring these into the clinics to be able to provide these results to patients. So anything else that you'd like to add on this, Dr. Mike?
I feel like this is a test that we can even see in the primary care. I mean, it's nice to know this information even before you go to your urologist, because let's face it, this is the very start of the diagnosis of a problem, way before we get into the more complex things that urologists do. So I believe even on a primary care level, on your first visit, a doctor is able to do this test. And it's a great way, if you have the symptoms, to determine which direction we should go to be able to treat. So, specialists can absolutely use this system, but I think even primary care physicians should take a look at the Bulbocavernosus Reflex System by UROVAL.
And we can help you with those 5 questions on what, you as a patient can ask your provider. We provided you with those tools. We have those in our previous episodes. Or if you are a provider, we can help you with what are you currently asking your patients and provide you with some questions that would help move towards, ruling out or screening for these patients who are suffering. So I want to thank you again, Dr. Mike, for your time today. And as always, thank you for watching us. Please be sure to like, subscribe, and share this video. We greatly appreciate it. If you are a practitioner or provider, we do have information on how you can reach us and get more information about the UROVAL BRS down in our description. There's a link to be able to contact us. Thank you very much, and we wish you a great day.
Thank you all. Bye-bye.